I am really happy to welcome next to our stage Robert Zarr. He is a paediatrician who works at Unity Healthcare here in DC. You might have heard him on NPR or read about him in the Washington Post. Dr. Zarr is going to come and talk to us tonight about the DC Parks prescription program and how it can improve children's mental health. Over to you, Robert.
Thanks for having me. I also am not quite sure what these slides hold. There's my website. So that was a really nice introduction too. I'm wasting my time here, right? So let me see what I can do in a 5-minute TED Talk. So I have been practicing for about 14 years as a primary care pediatrician here in DC and Columbia Heights. And 2010, I got sort of really intrigued with Last Child in the Woods and this whole idea of the connection between nature and health. I'm here to talk about mental health, and I'll do my best. Although, sort of just to back up a little bit, sort of a bird's eye view. In the U.S., we now, and in most developed countries around the world, we are now dealing with an epidemic of chronic disease, which we're talking about things like high blood pressure, diabetes, obesity, which leads to a lot of other chronic diseases, asthma, and of course mental health. And when I talk about mental health in my job, I'm thinking about things like depression, anxiety, bipolar, schizophrenia, and in kids in particular, attention deficit hyperactivity disorder. And just in case you haven't heard about ADHD, the last one, it's somewhere about 8 to 10% of kids in this country have a diagnosis and are on some medication for ADHD. It's an enormous public health concern for this country and countries around the world. So when I learned that there was a really interesting connection between spending time in nature and preventing and treating chronic disease, I thought, wow, this is rare in my lifetime. Do I get to hear something that heavy of a connection? And in my work as a primary care pediatrician in particular, although it's the kind of things that we're talking about really apply to more than just primary care, obviously. I work with a lot of specialists, and they come to me all the time. But in primary care, we focus a lot on prevention, and in pediatrics, we focus a lot on anticipatory guidance. There's a lot about how to prevent the things that are going to develop with time. And the things that develop with time, these chronic diseases, essentially lead to suffering and early death. So that's the thing, those are the things that we're dying of and suffering in this country and in developed countries around the world. Now, I don't think I need to tell this audience about this in case there's someone who hasn't heard, but in a global perspective, 70% of the world's population will be living in an urban area in just 15 years. So urban parks became my thing. I thought, it's great to have that epiphenal experience going to Yellowstone, that's great, I've done that. But, for most of the people who are suffering disproportionately from chronic disease, i.e. people of color and people of low income and both, they don't get those epiphenal experiences by and large. There are some good organizations that are organized to do that and kind of connect kids and adults in urban settings to these great parks that we have that are far away. But what I'm more interested in is how to tweak the daily lifestyles of people who are ready to have their lifestyles tweaked so they can have more access to nature. So that brings us to this. No, not that. That. So when I came back to DC in 2010, I thought it would be real simple. I'll just go to a website, the Parks Hill website, just be able to connect, bingo, done. That was not the case. So I created a lot of partners to work with me on this project that varied from local health agencies to park agencies to the National Environmental Education Foundation, on and on, academic institutions, hospitals, etc. And we came together, and mostly public health students were trained by me or a colleague of mine to go out and actually rate the green space. So what I'm in the process of doing right now is creating a prototype, as I like to call it, of park prescription. That is actually prescribing a park in the office setting. And I say prototype because as far as to my knowledge, this doesn't exist in the way we're doing it right now here in DC. What I mean by that is when I'm seeing Joey and he's 10 years old and he's 200 pounds and I want to do something about it, right? I want to be able to prescribe a park right there and then. Not later, not on the phone, right there and then. And so by grading all the space, putting it on what we call a park page. So a park page corresponds to one park in DC. You have 342 approximately park pages. They're in a database. We linked it to the electronic health record. So there you go. I'm in the office. Joey is 200 pounds and he needs to get out to the park. He wants to go to a park. He likes to swim. That's all he wants to do. Great. So I can search my database, find swimming, the parks that have swimming in it, and prescribe a park. Preferably one that he can walk to from his nearest home. If not, I can do a radius search up to 5-mile radius. So that's the idea, essentially, of what we're doing right now. There's a lot more to it than that. We're hoping the next steps will be things like having an app on your phone. So right now, park prescription is really, in the domain of a lot of the doctors, although you can get to this website yourself, www.aapdc.org/PRX. So it's publicly accessible right now. Is that up there? No? Did I say something fun? So this is an example of a park page. This is what it looks like. This is what they actually receive. So once we do a search, figure out which park best matches the patient, we print those out and actually hand them to the patient and the family. So the next steps will be things like an app on your iPhone or your Android. There'll be more searchability functions, so you can actually do like a real-time search, use GPS, social media components. If you want to play tennis in the next 15 minutes with somebody for 30 minutes, you can do that. So kind of like a Yelp of parks is what we're sort of imagining here. There's more things we're doing, but I think I'm probably over my 5-minute mark. Probably, yes. Okay, thank you.
Thank you very much.